not so much that it's the actual EEG finding, but it's the way we interpret it. And I've been doing this the same way for X number of years. And until somebody's like, well, why do you do it that way? And I'm like, oh, hold on. Like, let me really dig deep into like why I said that.
Fellow Homo sapiens, this week on Epilepsy Sparks Insights, we are talking to Shilpa Reddy, a paediatric epileptologist from Vanderbilt University Medical Center in Nashville in Tennessee, who, as well as directly treating children with epilepsy and working with their families actually, she lectures new clinicians on how to accurately diagnose kids through EEG readings. Shilpa tells us how that she learns from her students and how the field of epileptology is an ever-growing, exciting field to work in. If epilepsy research and treatments are of interest to you, then make sure that you press the subscribe or follow button and hit that bell to receive notifications of our weekly episodes.
My name is Shilpa Reddy. I'm a pediatric epileptologist in Nashville, Tennessee, and I work at Vanderbilt University Medical Center. So I'm a neurologist that specializes in kids that have epilepsy.
Why did you choose to specialize in the epilepsies?
Great question. When I was very young, I always wanted to be a doctor, and I thankfully had a lot of good role models. And so I knew I wanted to be a doctor, and I knew I wanted to work with kids. And when I started medical school, I kind of gravitated towards the neurosciences with the brain anatomy, the physiology of how the neurons work.
Crazy exciting.
Yes. And then as I was a young medical student, I was able to spend some time in in the pediatric neurology clinic at the University of Iowa. Fabulous mentors and teachers there. And I just kind of, again, more gravitated towards the epilepsy side of things within the field. When I did residency, I knew that I really loved epilepsy, and it just kind of deepened as I learned more. And then finally, as I did my fellowship, also at Vanderbilt, I really had was more in awe of like how the field is evolving and changing and how much more there still is to know out there. So it was just kind of a deeper respect that I gained for the field.
And so tell us about your work now and how you're getting others to join your ship and learn more about the epilepsies.
Yeah, so I am the fellowship director for the Epilepsy Fellowship. So I really get an opportunity to work with people that are still in training, they're still learning, they're kind of getting their roots in epilepsy. So I really love that. It's extremely fulfilling. And the nice thing about that is they're at that point in their career that they are also teaching me a lot, because as we mentioned, the field is constantly evolving, the technology is changing, and we learn more and more. So, they get to work with different attendings across the enterprise and the institution. So when they come back to work with me, they can teach me like what they learned from so-and-so or from this conference or what they read. So I'm pretty humbled by that. And then on a residency level, we have a pediatric and adult neurology residency here at Vanderbilt, and they all spend 3 years in neurology, and it's a mix of both pediatric and adult. When I graduated from this program, I thought I was very solid in my EEG reading skills, and I kind of wanted others to be as excited as I was and have, that passion. So what I did is create a curriculum for the 3 years of their neurology training, and it starts out kind of learning the basics of EEG, the fundamentals, and as they get on year by year, they add to that kind of repertoire. So each time they spend time on a formal EEG rotation, they go through the objectives, and kind of sit down with the fellows or the attendings that are reading EEGs for that week or that month. But I've also supplemented that with more of a self-guided module. So it's almost like a PowerPoint where it's a Q&A format where I put an EEG slide up, ask a question about it, and then they kind of think about it, go to the next slide, and realize they either got it wrong or right, and then there's a small explanation for each finding or whatever concept I want them to grasp. And then the other piece of the curriculum is more of an objective piece where they can take a test before they take their rotation and then after. So as individuals, they can see how much they've improved or if there's areas that they needed to focus on more. And I've kind of taken that and tried to at least open the use of the curriculum across the country. And I've been so grateful that a few institutions and other residency programs have asked me to speak with them about how we implemented the curriculum, and then I share the documents with them because they're just PDFs, and it's, if other people can benefit, and like I said, it's more of a self-guided thing, it's great that if even one individual can use it, then great, and they go into epilepsy, I consider that a victory. But we have a lot of people too that may not go into like the field of epilepsy per se, But in pediatrics, a lot of neurology patients have some form of epilepsy or some type of seizure. And so a lot of our trainees will go into private practice where they are reading, even though they're not epilepsy trained formally, they're kind of the first line of treating these patients, and they read their EEGs. So it's nice for them to have like a really solid foundation of EEG, and also the confidence. We talk a lot about imposter syndrome in every field of medicine and every career. And there was a recent publication that talked about how confident neurology residents are when they graduate about reading EEG, and it's less than 50%. And so one of my big goals is to really not only increase their curriculum and their knowledge, but just to give them that confidence too, that they've gotten good training and they are able to read.
And do you encourage the students to seek more information as well? So like, rather than them consider themselves as good at reading an EEG, they'll realize actually maybe I need to brush up on this later, or there might be somebody that contradicts my interpretation of this EEG and I should take that on board.
I love that you said that, because more so on the fellow level, where I feel like they have a basic understanding and they've learned the fundamentals, I actually encourage the fellows to challenge me or challenge whoever and say, well, I would have read it this way, or I would have interpreted it this way. And then I'm like, that's great. Tell me like your reasons why. Because, a lot of times, as I'm not calling myself super old, but as we get older in our...
Yeah, thanks. You like hello?
Cover up my gray hairs a little bit, but I think we get into this like very comfortable way of living and practicing medicine, and we just say, well, this is how we've been doing it for 20 years, 10 years, and you don't think about why you make these decisions. And so when the fellows come, I think it's great to have a fresh perspective, because they may have learned something, or they may have seen something that forces me to ask myself, like, why did I say that? Like, why am I choosing to make decisions that way?
So you just given me this flashback. So I was walking down this street in London once. Someone told me that people sold drugs down this road, and I was like, really? I walk down here all the time, never noticed. But the next time I walked down that street, I saw it straight away, because I was looking for it. But if I was not searching for that, so this is why I'm thinking of what you're saying, like I wasn't looking for a particular thing, so it just went over my head. And do you get why I'm comparing the two? It's like that with EEGs, no?
No, I 100% agree. And it's not so much that it's the actual EEG finding, but it's the way we interpret it. And I've been doing this the same way for X number of years. And until somebody's like, well, why do you do it that way? And I'm like, oh, hold on. Like, let me really dig deep into like why I said that. Because I do it with residents too. You never want... I don't feel like you truly understand anything until you can explain it to someone to like the very, very, very detail. Because it forces you to really think about like getting to the physiology of things, anatomy of things, and then come up with like an answer and say, this is how I got here. But it takes time, and it takes, like I said, that deeper level. It's easy to memorize facts. It's easy to look at EEG lines and say, this is what it is. But without truly understanding the building blocks, you miss out on a lot.
Something that we've been discussing this side of the pond for a while is the misinterpretation of EEGs leading to misdiagnosis of epilepsy. Would you say that happens a lot? Have you heard of that happening quite a lot?
This is fascinating, because I do give a lecture to the fellows about how to interpret normal EEG findings, which can be misinterpreted as, to your point, something abnormal. I will say in pediatrics, I'm going to make general statements because I can only comment on our practice, but
yeah, sure.
We do get a handful of EEGs that, are read by our colleagues in different parts of the state or different practices. And what I will say is, I think most people like to look at the EEG themselves and have their own data, because remember there is some subjectivity to interpretations. And so we want to make sure if we're treating somebody, we know that like we're confident that we made that decision based on something we saw, rather than something that like the patient reported or is written on a piece of paper that we don't know what the actual like the physical data looks like. So I don't know if I've had a ton of that experience on the pediatric side, but I do know there's literature published about certain findings on adult EEGs that get misinterpreted as epilepsy, and that's not very uncommon. So to me, it just kind of points to two things. One is just boosting the education that neurology residents and trainees have before they go out to practice, whether it's academics practice or wherever in the country, outside the country. And then two, I think it points to how we can collaborate with neurologists across any state, country, because I think the more communication we have, the more humility we have. Our goal is to treat patients, right? So it's not about ego and saying like, well, you interpreted this and I interpreted this. Like, let's work together, figure out what's best for the patient, and be able to kind of have these discussions.
It is about just valuing what other people say, taking that into consideration, because none of us are always right? And there's always aspects at which you can look at things.
100%.
What does the future hold for your residents, and how are things going to go forward in terms of, pediatric epilepsy, neurophysiology, all these things put together?
So what I find really exciting is some of the technologies and like updates that we've had in epilepsy surgery. The field in general is shifting because we've classically thought we try medications, we try multiple medications for epilepsy, and if that doesn't work, we just keep trying more medications, which is, it's good that we have more medications available on the market, over the last like 10, 20 years. But what we found is that there are certain types of surgery that can be curative for certain types of epilepsy. And I know that I can't speak for everybody because everyone has different reasons for their epilepsy and seizures. But what we're doing is trying to, as a society, is increase that awareness, not only at like our level as epileptologists, but then at the general neurologist level, at the general pediatrician or general practitioner levels, and the patient level, because often patients can be their kids or their own like advocate. So increasing the awareness about the types of surgery available and also which ones would be applicable to them or not. So what we're doing is we have our Twitter handle, VUMC Ped Epilepsy, where we can publish or not necessarily publish, but just there's events available. This is the type of seizure, going through different facts and things like that. We've also been able to create some resources in our clinic with the help of our amazing residents that patients can scan a QR code and then go directly to this part of the website that talks about what's an MRI, what is epilepsy surgery.
That's so cool.
What is a ketogenic diet? So that's kind of cool. And then kind of the next piece of what I want to do personally is go out into our state of Tennessee and more like into pediatricians' offices and our like neurologist offices and introduce ourselves so that people know that we're available. People know that they can refer anytime. Because I don't think there's any, there's a lot of barriers, of course, to patients getting access to appropriate care. And I'm not going to be able to address all of those with my presence. But I think just, again, having open communication, understanding what those barriers might be. The first step is talking to them where they live, right? And talking to providers that they've known their whole lives so that we can form a relationship and be able to help each other.
Thanks so much for your encouragement today, Shilpa, and letting us know that you are like truly going the extra mile or kilometre or whatever people want to call it, and there is heaps and heaps of information out there for individuals, for families, and for other clinicians. Just follow Shilpa or come my way and I can forward you on. The more we work together and share our information, I think the more we can improve people's lives. Thanks so much.
I agree. Thank you so much for having me.
To learn more about Shilpa, make sure that you check her out at torierobinson.com/epilepsy-sparks-insights, where you can find links to her work. And if you haven't already, make sure that you subscribe to the channel to receive weekly episodes featuring some of the world's leading epilepsy specialists and researchers.